Hello, everyone. My name is Nkechinyere Ijioma. I'm a fellow in training at the Mayo Clinic, Rochester, Minnesota. I have here with me Dr. Kim Williams, who is going to be our president of the ACC starting tomorrow night. How are you, sir?
Wonderful, and thank you very much for having me.
Thank you so much for talking with us. So, Dr. Williams, I have a couple of questions for you. Number one, in the college, there's a lot of talk going around about non-clinical competencies and how to incorporate that in our training for fellows. How do you propose to do this in your year of leadership?
Well, actually, the college has started already with leadership development and engaging the FITs, listening, as well as getting good advice from the early career folks on what is it that you need. How do you learn to put the elements together of a contract? We just had a session here today where the early career people were actually giving advice on what to look for. I can tell you that it's working because as I'm hiring people, which I do, they're getting more and more sophisticated and asking the right questions, questions that I didn't even ask not too long ago. And so I think we are being very effective, and I hope that all of the fellows will continue to look for the programs that talk about practice environment, the academic environment, how to do clinical research, how to analyze studies so that you, even if you are in clinical practice, you are aware of the pitfalls of a study and you can identify them very quickly. And so we've got a lot of non-clinical skills that are really critical to the future of cardiology and having a successful career, whether it's in practice or in academia. And the college is taking up each one of them in various formats, and so I'm hoping that each of the fellows will avail themselves of these.
All right, sir. And then what's the strategic plan for the ACC? As one of the points is to involve more fellows in the college. How do you propose to do this in your year of leadership?
So one of the things that we try to do is to make sure that the college leadership tracks have fellows embedded, and that can be done through our committee structure, through the sections, councils, as well as making sure that whenever there's a big initiative that we have our fellows in training and early career folks really weigh in on where it is that the college wants to go. We actually have a lot on our plate. Obviously you can't focus solely on one area when you've got a strategic plan with 6 elements to it. But I would say that the top ones for me personally are the population health, the advocacy, and the transformation of care. And as we try to roll out programs that will help with healthcare disparities and solidify reimbursement in a way that's reasonable and not penalizing us for seeing patients, and transforming care from volume to value in a way that doesn't make it a disincentive to actually practice medicine. We've got some challenges, and we have committees dedicated to this, and each one of those committees are going to have the young people involved.
Well, thank you so much, sir, for spending your time with us this afternoon.